first came in here, I was getting neck pain, I had lower back pain, I was getting headaches in the back of my head, and my sciatic nerve was bothering me. Since I've been in here with him, most of that's been eliminated. So, I mean, I'm free to do a lot more things that I couldn't do before that I can do now. First of all, emotionally it affects you because you feel so bad. You know, you're aching all the time and you just don't feel like doing anything. And I'm a big golfer and it was affecting that. Like, I just couldn't go out and play golf the way I used to play. So since I have been coming to Dr. Bulow, and since I'm feeling so much better, my attitude's a lot better and my golf game's really improved. So I'm very happy about that.
Part of the really cool thing about Greg is he represents a wide demographic of patient that has worked their entire lives physically, right? Just doing a lot of manual labor, things like that. And they end up later on in life with arthritis, stiffness, pain, a lot of these chronic issues that they are told that are just part of getting older, or they just are gonna have to learn to live with it. And it's been such a joy taking care of Greg, being able to see him return back to, like today he talked about playing golf and just getting out there and getting back into life. And it's a really, truly rewarding thing. And so that's one of my favorite aspects about what we do, and favorite aspects about patients that are the same age and same kind of demographic as Greg that have worked their whole lives. It's really cool to see people getting back to living the way they're supposed to.
We had taken my mother-in-law to a doctor. She has Meniere's disease. And there was a woman sitting in there, and we started talking, and I was telling her about how my back was hurting and my neck. And she said, well, have you seen a chiropractor? And I said, yeah, I did go once, and they cracked my neck and I felt like I was gonna die. She says, well, this guy I go to, he doesn't do that. He's a really good doctor. So I said, what's his name? She goes, his name's Dr. Bulow. He's in Cranberry, and I think you should, you know, give him a look at. So I made an appointment with him, and I'm so glad I did. But it was really funny that you know, that I met one of his patients in a doctor's office. So that's about how that came about. It's typically new to me the way he operates. You know, I was expecting them to manipulate my back, and I told him I didn't want my neck cracked. But it was really interesting, the 3D imagery he took and showed me. I had arthritis on my spine and everything, showed me how out of whack everything was. And I found it very interesting, the techniques he used, and it was very knowledgeable and informative for me.
With Greg, an interesting aspect to his care was that he had some complications around the safety of working with him. A lot of people that have calcifications and arthritis, they can't have the same spinal adjusting or manipulative procedures that the average 20-year-old, for example, can have. And I'm really grateful for my mentors, my education in Upper Cervical Chiropractic, because we have tools and tests that we can deploy that allow us to be extremely gentle and extremely precise and work with someone that has certain risk factors where before they've been told you cannot have any type of chiropractic care done to them. In cases such as Greg's, we would say, no, we actually, in a lot of cases, can work with you. And so that's just a really rewarding aspect of what we do, is the ability to work with people that maybe have a higher risk profile.
Actually, after about 2 appointments, I started noticing I felt a little bit better. And then from there on, I noticed big improvement. And it actually has changed my life for the better. I get minimal pain if I get it at all, and usually when I do get any pain, it's because I've pushed myself past the limits. I mean, Dr. Bulow explains to me, you know, things I can do and things I can't do. But I have to tell you, I feel great right now compared to the way I used to feel. It's just like night and day. It really is. Yeah, I tell everybody that, you know, talks to me about back problems, I say, you got to give this doctor a try. I says, his techniques are different. I says, and you really don't have anything to lose. I says, you know, if you have trouble with regular chiropractors, you want to give this doctor a try because his techniques are great and the staff here's wonderful. I love the staff. I wouldn't change a thing in this office. No, I'd just like to say if you are experiencing pains, you know, back pain or neck pain, or I even had breathing problems when I jogged because of the pain in my back, and that went away. But if you're experiencing anything like that, I would recommend that you give Upper Cervical Chiropractic a chance. I mean, I think it would just expect miracles. That's what I say.